Hi, my name is Wafa Nomani. Today I'm going to be talking to you about the synergistic effects of Feraheme, as well as several ROS-inducing drugs such as brucitol, Avastin, and parthenolide to treat pancreatic cancer, such as pancreatic adenocarcinoma. So pancreatic cancer actually has a 5-year survival rate that is incredibly low, which is 3%. And on top of that, the current treatment regimen includes chemotherapeutic agents, which have many adverse side effects on the healthy tissues. So, iron oxide nanoparticles, such as Feraheme nanoparticles, actually present as a promising drug delivery agents, as well as potential generators for reactive oxygen species, abbreviated as ROS. So, in this study, we non covalently loaded several ROS inducing drugs, such as brucitol, Avastin, and parthenolide, onto the surface of the Feraheme nanoparticles. So we first measured lipid peroxidation, which is a direct indicator of ROS, via flow cytometry. So we basically treated ASPC1 pancreatic cancer cells with several concentrations of brucitol, Avastin, or parthenolide with or without Feraheme at several concentrations. So we found that the brucitol 100 micromolar plus Feraheme combination group, which is indicated by this histogram to the left, and the Avastin 10 micromolars plus Feraheme combination groups produce the significantly highest levels of lipid peroxidation. So this blue and green peak respectively shifted to the right indicates significant levels of lipid peroxidation compared to the controls. So therefore, we did individual lipid peroxidation assays on brucitol and Avastin, and for both experiments, we found that the combination groups, the 3 combination groups, actually produce the most lipid peroxidation levels, which would indicate a synergistic effects between these drugs and Feraheme that are producing this significant level of lipid peroxidation and therefore ROS. The corresponding toxicity assays, the MTS assays, didn't actually show anything for brucitol. So we treated brucitol by itself and with Feraheme, as well as with a N-acetylcysteine antioxidant, which is supposed to rescue ROS. We didn't really see any difference in toxicity here. However, for the Avastin, we saw that Avastin with and without Feraheme as quite toxic, and is actually the ROS level is actually rescued by the NAC antioxidant, which would indicate that Avastin does indeed play a role in ROS generation. The second part of our project was actually functionalizing the surface of the Feraheme nanoparticle with a dimethylamine conjugation. So we found that with increasing concentrations, lipid peroxidation levels increased, and therefore cellular entry also increased.